Thank you guys so much for joining me today as we continue and give you an update on our fight against COVID-19. Before I begin, I wanted Oklahomans to know that our hearts are with Sergeant Craig Johnson and Officer Arush Zarkashan, the two Tulsa police officers who were attacked during a traffic stop earlier yesterday morning. I ask Oklahomans to join Sarah and I in praying for these officers, their families, the medical workers treating them, and the entire Tulsa Police Department. This was a senseless act of violence, and our law enforcement officers need the support of our community now more than ever before. I also want to thank Secretary Jerome Lothridge and Secretary Casey Schramm for their service to Oklahoma. They are both significant reasons why we have been one of the national leaders in our COVID-19 response. I wish them nothing but the best as they return to their professional careers. We are fortunate to be able to promote two very talented people to replace them and keep our momentum going. Elizabeth Pollard will take over as Secretary of Science and Innovation. She was Deputy Secretary under Dr. Schramm and is a national expert on testing and health care technology. She will give us an update in a few minutes. Welcome to the Cabinet, Secretary. Kevin Corbett will take over as Secretary of Health and Mental Health. He'll be adding that to his duties as CEO of the Oklahoma Healthcare Authority. We know he'll do a fantastic job. So now let's talk about COVID-19 and our situation here in Oklahoma. First off, I want to thank Oklahomans for their work up to this point. I believe that Oklahomans have handled COVID-19 better than any other state. Both the president and the vice president told me that we were a national leader in the way that we handled this pandemic. Today we are 68 days, more than 2 months into our reopening. We are more than 30 days into our phase 1, or right at 30 days into our phase 3 plan. And as expected, as we reopen, our positive cases have been increasing. Just because we're back open does not mean we can let our guard down against this virus. Since we've reopened, 71% of our new cases have all been under the age of 50. When you look at the death rate in that age group under the age of 50, it's 0.08%. We have been committed from the beginning to making decisions based on data here in Oklahoma and not what we're seeing in other states or on television. We've also been committed to being transparent and sharing all the data with Oklahomans so they can protect themselves and their families. I'd like to turn it over to Commissioner of Health, Lance Frye, to give an update on the latest trends. Commissioner Frye.
Thank you, Governor. Today, OSDH reported the largest increase in COVID-19 cases since the pandemic first arrived. We had about 585 positive cases. Our COVID-19 hospitalizations remain manageable and are not growing at the rate that we experienced in the spring, and our death rates remain comparatively lower. We also continue to have more recovered cases than active, with more than 10,000 recovered and 3,672 active cases in the state today. In all, Oklahoma continues to be in a better position than many of our neighboring states and hotspots across the nation. We're ranked 42nd in the nation in the cumulative incidences of COVID-19 per 100,000 persons. Today's increase will not be the last one we expect to see over the next several days. We ask Oklahomans to get tested before and after attending large-scale events, and we have seen record interest in our testing pods across the state. This is most clearly evident in that we exceeded our June goal to conduct more than 90,000 tests having received results on 507 specimens. And in our decision to support additional stand-up testing locations in Tulsa, Oklahoma, and other cities over the past few weeks. Heightened interest in getting tested is a very good sign. This allows us to inform active cases in order to quarantine, to conduct tracing efforts, to encourage additional testing, and to understand the rate and reason for community spread. As you can see in this chart, Oklahoma has experienced increases in COVID-19 cases. It's differed in that since June, roughly 40% of these cases are under the age of 35. These individuals are at low risk. We face a critical situation as we approach 4th of July with a number of young people in Oklahoma who have the virus and are largely asymptomatic. Young people, rightfully so, will want to interact with their families and loved ones. In the vulnerable category of over the age of 65, grandparents, aunts, uncles, parents. Young people need to be very careful since they could be carriers and not symptomatic, and could easily pass on this virus to their loved ones. As we celebrate our nation's freedoms, we ask you to please wear a mask, frequently wash your hands, carry 60% hand sanitizer, and celebrate outdoors with ample of physical distance. Please be respectful and mindful of those with weakened immune systems and those that are older in age. We have also seen community spread from indoor gatherings, particularly for funerals, weddings, and large family gatherings where events are centered on socializing for long hours. Since June 1st, we've also seen an increase in COVID-19 patients in hospitals. We're roughly 40% below our height of 560 in late March and early April. There were 306 on April 24th, and we have 315 today. April 24th is when we started our reopening. I want to clearly communicate today that our hospital infrastructure remains strong. We have strategically and thoughtfully invested in this area thanks to the leadership of Governor Stitt, and I will let him get into his discussion regarding additional CARES funding that he's delegating to agencies to continue building this critical healthcare infrastructure.
Thank you, Commissioner. I want to echo what he said as we head into the 4th of July weekend. We need to continue to protect those who are most vulnerable. So we need help of all the young people. Be careful if you're planning to be around your parents, your grandparents, or anyone with immune compromised systems. I was on a call with the Vice President yesterday. This morning I spoke to Secretary Azar and Dr. Deborah Birx and the Surgeon General. The federal government is going to be rolling out a color-coded system to help Americans make decisions based on the situations in their county. So I will be issuing an executive order directing Commissioner Frye and the Health Department to develop a color-coded system for our state that will show Oklahomans the data on a county-by-county basis and give them the freedoms they need to make decisions to protect their health and their families. Our data shows COVID-19 has affected Oklahomans differently than we expected. Instead of large waves, we've seen localized outbreaks in different parts of the state, kind of county by county. So giving county by county guidance gives Oklahomans accurate pictures of the situation in their communities. It also encourages them to be personally responsible for their actions, knowing their behaviors can help keep their county in the green. So being in the green does not mean you're going to have 0 cases. We know we will continue to see new cases as we find our new normal. We may be dealing with this virus for the next 24 months. This system will show Oklahomans how to deal with this on a prolonged basis. The White House is also directing Americans to wear masks in public where social distancing is not possible. I am strongly encouraging Oklahomans to follow this guidance and wear a mask in these situations. Oklahomans, we come together to support each other. We support our neighbors in times of trouble, like after a tornado or a flood. We can extend the Oklahoma standard by protecting our neighbors who may be more vulnerable to this virus. Research shows that wearing a mask when you can't social distance significantly lowers the transmission rate of COVID-19. It may take some getting used to, but it's a small price to pay to be able to keep our businesses open, our economy running, and to be able to watch OU and OSU stick it to the Shorthorns on the football field in the fall. So it's this easy. I also want to give you an update on how we are continuing to expand our state's testing system. Our Cares Forward team was authorized projects to quickly invest tens of millions of federal dollars in testing capacity, reporting systems, contact tracing, and case investigations. A couple examples of these include $4.2 million for the health department to buy mobile health units that will make testing and screening more available across the state. We're also making a $15,000 grant available to each long-term care facility. This money will help them purchase PPE, additional cleaning supplies, and use telehealth medicine. This program will total about $35 million for facilities across the state. Testing and data analysis will continue to be very important as we move forward in our fight against this virus. I'd like to turn it over to Secretary Pollard for an update. Secretary?
Thank you. Our approach is one looking at three key areas that we want to be addressing around testing through the Department of Health. First and foremost, we want to continue to provide the testing capability that we've been over the last couple of months in particular, roughly 100,000 tests per month. And we're allocating about $35 million towards this effort over the foreseeable future, which will really allow us to address more telemedicine capability in rural areas as well as testing and monitoring. Our goal is to continue to keep Oklahoma at the forefront as national leaders around these testing and monitoring strategies. And this will also help us support as schools reopening for both teachers and children, as well as how we're supporting businesses as they're working to reopen. We are also continuing to look at commercial partnerships. The partnerships we've put in place have been paying good dividends for us in regard to results and meeting the needs of Oklahomans, but we think we can do more, and so we're looking at certain commercial partnerships which will enable more point of care strategies and mobile testing. Roughly another $15 million is going to be allocated to digitize and modernize our data entry and reporting capability across the state health departments and the county offices. It will also support our efforts to do a better job of contact tracing, just because as our test numbers increase, we need to do more. And so this money will be allocated to make that possible. Thank you.
Thank you, Secretary Pollard. As I've said, it's been my priority to do two things. First off, protect the health and lives of Oklahomans. That was the priority number one with all the decisions we made. Secondly, it's to limit the impacts and get our economy recovering as quickly as possible. We need all Oklahomans to play their part in slowing the spread of this virus and allow us to continue to keep all of our businesses open and get Oklahomans safely back to work. So please continue to wash your hands frequently, maintain social distancing, wear a mask when that's not possible. Now we'll open it up to a few questions.
Security commissions holding a mass gathering tomorrow in the West City to help people get their benefits. Is that a good idea in the spike in COVID numbers? Is it safe for Oklahomans to go to that?
you know, the OESC, just to speak on, you know, kind of broadly on that, they have gotten through 246 claims. So 246,000 claims so far have been paid by the OESC, and then we have about 4,000 in the backlog right now, and so they're working through that. You might have seen some of the folks in line trying to get through there, and so we wanted to meet with them individually because the last 4,000 applicants have language barriers. A lot of them don't speak English. They have technology issues. They can't actually apply like the 246,000 that we've processed. And so, yes, we wanted to make ourselves available to them so we can get those things, get them paid if they qualify, and get that money into Oklahoma's hands.
So from a public health perspective, is that a good idea to have another large gathering right now?
Well, I don't know what you call a large gathering. If you can, I just said, if we can remain social distance, great. If not, we encourage you to wear a mask. But I think people that are looking for unemployment benefits, they want to meet there. And so we want to make that as safe as possible for them, and we want to make that available.
They'll have social distancing in place at the Frye Center. Okay.
Would you consider giving local municipalities the power to enact a facial mask requirement so that they can back local businesses who want to create, a greater degree of safety in their own businesses?
Well, from the very beginning, I mean, we believe in local control, and we haven't been heavy-handed with the different municipalities, and so they're close to the people, and so we're trying to give guidance over the state of Oklahoma. We're trying to follow the CDC recommendations, but we've been very clear about we're not going to mandate masks throughout the state of Oklahoma. When you start mandating things, then the very next question is, well, how do you enforce it? And and so those are the things we're going to recommend it. I'm not worried about Oklahomans. They've handled this better than any other state. And again, we have 315 people across the state of Oklahoma in the hospital right now. We built capacity to 5,000 hospital beds, and that was the whole purpose of our 25 executive orders. That's the purpose of what we're doing with our color-coded system now that we're going to be rolling out later this week. It's always to flatten the curve. The goal was never to have 0 cases in Oklahoma. It's just not practical to have 0 cases, but it is practical to flatten that curve and make sure we protect our fellow citizens, and that's exactly what we're trying to do, and I think Oklahomans are doing a great job. The other thing that it might have got lost, that I love the fact, one of the points that Colonel Frye made, is we had 306 people in the hospital in the state of Oklahoma on April 24th. We started our reopening plan. Today we have 315 people in the hospital, even after 68 days of reopening. That's a great stat. It's just a testament to how Oklahomans are handling this situation. Yes, please.
Secretary, early on in the pandemic, a lot of your time was spent trying to obtain testing supplies, well, other things related. Is that still the case now? I mean, how aggressive are you having to be? How much competition is there with other states for testing kits, or is that situation improved a lot?
Sure, it's improved a lot, and I would say that it's not impacting our ability to have capacity for the state. We've built great commercial partnerships, both through suppliers as well as service providers, and that has worked remarkably well for us. As I mentioned, we're also looking at some more point of care and mobile testing strategies that might come through commercial partnerships, and those are being explored now.
Is there, I know early on there was talk about, innovative ways to make testing quicker or less invasive, and I know that's happening all over the world, but anything locally on that front that you're aware of?
We are looking at many things, how we use antibody testing as a means or a precursor to determining PCR testing. We're looking at all of those things, but we want to do it in a way that's most effective and also cost efficient for Oklahomans, and so that's still being reviewed.
Dr. Frye, can I ask, thousands of people are being tested, county testing pods over the next 2 days. Is the health department planning to work over the holiday weekend to notify people of positive results, or should they expect to hear on Monday if they tested positive?
The pods, the tests usually are anywhere from 24 to 72 hours, and every lab is different. Some of those run over the weekends and some do not. So we try to notify as soon as we can when we get the testing back, because we know that's important to people. But everyone operates a little differently.
So it's possible people could get a call, say, on the 4th of July, saying that they tested positive?
It's possible.
Yes, sir.
The CDC has recommended, wearing masks for more than 2 months now. In your public event Friday in Terra, you didn't wear a mask yourself. What's changed in your mind as far as mask wearing since Friday?
Well, the CDC guidelines, if you can't maintain social distancing, then they're recommending wearing a mask. We're trying to follow that guideline. And again, that's where, as governor, I don't want to get to a point where we start shaming people for choosing not to wear a mask. There could be reasons why they don't want to wear a mask or they couldn't wear a mask. And I'm not going to mandate masks in the state of Oklahoma. So me not wearing a mask is something that at that event, I don't know if I was close to people or what, or whether you were there or whether you just took a picture of me. Gotcha. Okay.
I know you said you won't mandate masks here in Kansas City yesterday. Is that something you would reconsider if we continue to see single-day spikes like we've seen today?
No, I will not reconsider mandating masks. We believe in freedoms. I will not mandate that in the state of Oklahoma.
What's your experience so far wearing one? As I say this as my glasses fog up and I can kind of hardly see you. What's your experience when you normalize this concept for people? I mean, you've been not doing it, but now you kind of are, and hey, you made that change. What's your experience so far?
Well, again, if you're going to be in a close proximity to other folks, we need to protect our fellow citizens. We want to continue to get life back to normal. We don't want to see spikes, and so whatever we can do as a state to slow the spread, we want to do it. And so that's why I'm demonstrating wearing a mask today. We can do it. We can keep each other safe. And again, but I also I don't want to alarm Oklahomans either. We have 315 people in the state of Oklahoma in the hospital, 315. On April 24th, we had 306. So pretty much flat, even though we've been open for 68 days. So this is about hospital capacity. The goal was never to have 0 cases in the state of Oklahoma. I'm on the phone with other governors weekly with the vice president, and some of the states that have not reopened and they're still in phase 1 and are going backwards, the question to them is, when is the right time to reopen your economy? Is it August, September, October, November? Are there going to be 0 cases in their state when they do decide to reopen? And so when you think about this could be our new normal. And this is what I'm telling Oklahomans for the next 24 months. We need to learn how to live with this, and that's why we're going to roll out a county by county heat map that allows us to understand and know how to be more social distance if we need to, because we have more hot spots in certain areas of the state.
Change directions on you real quick. It's election day. You said you've been on the phone with a lot of people. Looks from Facebook and whatnot, you've been on the phone with some of your legislative friends who you have endorsed. Has that been a fun experience coming out of a decently acrimonious session to then get some endorsement requests from people? Have you enjoyed that?
It's fun. I have a lot of friends in the House and the Senate, and looking forward to getting some of those guys across the finish line that I'm supportive, that I think are great for Oklahoma. One thing that I want to point out, I think Mark Gower, who's our emergency management director, has done a fantastic job working with the election board. We have provided PPE, disinfectant, cleaning supplies to at least 37 different county election boards, just to make sure that's as safe as possible as people get out and exercise their right to vote. So it is election day. Those folks watching this on TV, we want to remind them to get out and vote.
Today on Medicaid expansion, early on in your tenure, you said that you wanted to offer an alternative to that. Obviously, you said the downturn in the economy kind of stifled some of the plans. I guess looking back, is there anything that you think could have been done differently in order to offer a more robust plan or an alternative to Oklahomans, or is this just a product of the economy?
You know, that's a good question. I think, you know, in my opinion, 802 is really harmful for Oklahoma because it's going to be put into our Constitution. So if that passes, it goes into our Constitution. It gives us no flexibility. We have to fund that for the next 50 years, 100 years. We already have Medicaid in Oklahoma. We cover 800,000 Oklahomans, the age, blind, disabled, pregnant women, children. So this is a new population, adult population, healthy adult population without children, basically. So there is a cost to Oklahomans. So the question is, how are we going to pay for it? And yes, the unemployment with COVID has increased the cost. And so it's predicted between $164 million to $200 million cost at this point. And the question that Oklahomans need to understand or need to ask themselves is, how do we pay for it? We don't have an extra $200 million sitting around. So you got two questions. We actually have $1 billion deficit we're facing next year. So you're either going to raise taxes, which I'm never going to be for that as the governor. I think the state can never spend enough money. We can't just keep raising taxes on hardworking Oklahomans. So secondly, the only other option would be to take that out of certain state agencies, whether it's education or it's roads and bridges or it's public safety or DHS. The legislature is going to have a really tough job if 802 passes. What agency and where does that $200 million come from? So for those reasons, in my opinion, hopefully Oklahomans agree with me. 802, we should vote no on that.
Well, assuming it passes, you may not want to make that assumption right now, but what would be your next plan of attack to improve healthcare in Oklahoma?
Well, one of the things that we can do is change our delivery method. Right now we have a fee-for-service model that basically means that we just pay for whatever tests are run, and there's no focus on outcomes. 41 other states have a different reimbursement mechanism in their Medicaid programs. They reimburse for outcomes, and they hold hospitals accountable to readmissions and how the health of that person is becoming. So those are things that I'm looking at, that I know our health department's looking at, and really, isn't that what we're about? We're about healthier Oklahomans. And so for all those things, we need to look at what other states are doing. Why are we ranked where we're at in health outcomes? And a lot of it has to do with the way that we reimburse hospitals and providers for care.
Is there a scenario COVID cases continue to increase that you'll consider going back to phase 1, phase 2, if the cases continue to rise?
Well, sure. I mean, we obviously look at that. We're in contact with our health professionals all the time on a daily basis. We're a long ways away from that. You would have to overrun the health system because that's why we shut down in the first place. So that's why we limited things like elective surgeries. That's why we encourage businesses to work from home. We were one of only 9 states, by the way, that did not issue a shelter in place. We really focused on the most vulnerable. The most vulnerable, we still have to watch that. That's 65, 75, 85-year-old Oklahomans. We're still encouraging them that they're safer at home. They have to take more precautions than people under 50. And like I said before, the under 50 group was 0.08%. And my job as governor and with the health department, my directive to them is to continue to provide as transparent as data as we can to Oklahomans, give you all the facts, and then give Oklahomans the freedom to make the right decisions, the best decisions for their personal health, for their families, and for their businesses.
Governor, you said a few times hospitalizations have remained pretty flat during the reopening. But then we go and talk to hospitals and they're seeing more cases now than they've ever seen. How do you explain that disconnect?
I'm not sure exactly what they're saying, but we have, I get briefed every single day. We have information sent to us from every hospital in the state. We count the gloves, the masks, the PPE equipment. We've set up a system to make sure that we know exactly what we have in our hospitals, how many COVID patients we have, how many presumptive COVID patients, how many ICU patients, how many beds are available, how many ICU beds are available, and we have a very robust system of tracking. So I'd be interested to find out, who's giving you that data point, but 315 across the state of Oklahoma is the facts as of 2 o'clock today, or whatever time it is right now.
You were quicker than I was. Could we get one more little shot of you up there in that mask with your your team or your wife or first lady or anything?
Look, the first lady up here with me, she's much prettier than me.
You said it, not me. Thank you very much. Perfect. Are you accepting donations of masks if people want to send you their own special ones?
They're on to mask to, you notice our beautiful Oklahoma logo on this mask. So I don't know where you can get these, but we'll make them available. But yeah, it's not that hard. Not that hard to wear a mask if you can't be social distance.
Thanks, everybody.